How much longer do I have before I have to change to a healthy lifestyle? Good morning, good afternoon, and good evening to all participants throughout the world. Welcome to our webinar today. The future is now. Physical therapy is leading the way through lifestyle medicine. Thanks for joining us today. A couple of housekeeping items. There will be a spot to ask some questions. Please do so throughout the webinar, and our panelists will address those questions towards the end. So, quick introduction. Technogym, the wellness company, was founded in 1983 by Nerio Alessandri. This is a picture of the Alessandri's family garage, and you see our first piece of equipment designed, which was a hack squat. Moving on to today, we have the Wellness Village in Cesena, Italy. Now, this is a beautiful campus. Advanced manufacturing, global headquarters for Technogym, an amazing corporate wellness amenity for the employees of Technogym and the visitors that come to see wellness in motion. But I want to tell a very cool story as part of the oral tradition of Technogym. So Technogym was founded in 1983. And Nerio Alessandri had the vision for this village in 1990. Now keep in mind, Technogym started operations in North America in 1996, and it took Mr. Alessandri 10 years to acquire the various plots of land that make up this site today. This village was opened in 2008, and today is a reference point for corporate wellness and manufacturing and a workplace throughout the world. But I tell you that story in terms of the vision that goes beyond what we do this week or a quarter. We're talking about a vision that expands decades. And a lot of what you're going to be hearing today about physical therapy and leading the way through lifestyle medicine is ultimately about sustainability and having vision and foresight to what the future could be and how do we create that now. So to lead us in that panel discussion, my colleague Jason Jones, who I work with as a key account manager for Technogym. Jason has been with us for more than 10 years and has a background actually working in medical fitness facilities. So he brings with him the voice of the customer and understanding how to navigate the complexities of getting business done within healthcare systems. Jason, thanks for being here with us, and I look forward to hearing what you and Josh have to say.
Absolutely, Keith. This is my pleasure to host our panelists today. Josh Lyons is the CEO and Managing Director of Pinnacle Medical Wellness. Pinnacle manages privately held physical therapy organizations and lifestyle medicine centers for 2 major hospitals. What's an interesting fact about Josh is he's actually been a Technogym client since 2008. So we've been able to go on an extremely nice journey with Josh throughout his business. And at the underlying aspect of Josh's business is that he truly believes exercise is medicine, and he enjoys working with clients across the entire medical continuum to help them to implement lifestyle medicine strategies into their everyday practice. So Josh, thank you so much for joining us today. We really appreciate it.
Absolutely. Thank you for having me. I
Absolutely.
appreciate being invited to this conversation, and certainly good morning, good afternoon, and good evening to everybody as well. We're just trying to get to the afternoon still here on the Pacific Coast. But I tell you, I'm glad I made it because I was just racing from my doctor's appointment where I was asking him when I needed to adopt a healthy lifestyle. Unfortunately, I have a couple more years, he said. So there you go.
That's awesome. That's awesome, Josh. Well, thank you very much. And so let's start off talking about your business, kind of a historical perspective. So Pinnacle started off as Pinnacle Physical Therapy a long time ago, I believe back in 2004. And but as your business progressed, you noticed that there were kind of some underlying issues with the way that you were delivering traditional physical therapy, you know, some of that came from patient experience, some came even from the physical therapists themselves. So what were you noticing is some of the underlying issues with the traditional PT delivery?
Sure. So let me give you a little background about where I'm coming from on this. We opened Pinnacle in September of 2004. So we're moving in on 16 years now. We, meaning my wife, Stacy, and I, opened Pinnacle. Stacy is the physical therapist of the group. So in full disclosure, I am not a physical therapist, but I assure you that I do come in peace. And I think that's an important thing to note. And so together, we have run this company for 16 years, and we have certainly seen a decent level of transition as we've grown. So yes, indeed, we started as Pinnacle Physical Therapy, and that would have been one very small clinic with a very small facility where Stacy practiced many of her skills that she learned in school the same way most physical therapists have done for 30 or 40 years. And it was a great business. But something happened right around the second or third year of our existence. And that's probably really where our journey starts. And it starts with a letter from a major insurance company stating that they were no longer going to pay the rates that they had been paying us for the visits that we were seeing for their clients. And in fact, it was going to be about 50% of what they had historically been paying us. And this being us being a new business, and at that point having expanded into at least 2 and possibly 3 facilities by that point, this was very concerning to myself, being on the business side of things. And so I really felt strongly, and so did Stacy, that we needed to get away from our reliance on insurance reimbursement. And that's, of course, everyone, that sounds way easier than it really is. But there were other issues as well. We also, being new to the market, there were referral patterns that had been set up that we were trying to break through. We weren't comfortable with relying on others for referrals and patients. We didn't really like the concept of discharging clients, sending them away, the linear nature of the progression where we celebrated them leaving our facility. And we didn't really appreciate the insurance companies dictating the course of care through the number of visits, for example, that they were allowing their patients to come to therapy. So interestingly, near about that time, and this is a true story, by the way, we had a client who had just opened a fitness facility in our community that they'd adopted the Technogym platform and equipment into their facility. And she kind of knew what we'd been talking with her about some of our ideas, and she dropped a Technogym catalog on my desk. And that really is the point where we began to rethink what physical therapy could be. And so that's where we start. And so when we start to talk about that, I really think about a quote by a gentleman named Wayne Dyer. He's considered the father of motivational speaking. And he's quoted once as saying, "Change the way you look at things, and those things you look at will change." And you know, as another tidbit about myself, I used to be a teacher, and I used these pictures at times to show my students how history could be viewed that way. But I also think it's relevant for this conversation. So I'm sure as I share this picture with you, 80% of you will see an object very clearly. The other 20% will be caught between 2 objects and not sure what to do with yourselves. But most people see a particular object that I will not tell you what you should see right now, but I'm going to take it away and I'm going to just flip it 90 degrees. And those 80% that were seeing one picture are now going to see something completely different. The other 20% are still confused about what it is they're seeing and are getting frustrated at me. So I won't spend too much more time on this. But the point is that we're looking at the same picture, yet what you see by flipping it around is something that's entirely different. So we began to take this approach with physical therapy. And when we look at traditional physical therapy, the roots of physical therapy, again, me being a history teacher, I'm interested in the history of the physical therapy profession, and have studied it. And we see that physical therapy comes out of a need to treat war-related injuries from World War I, where war changes, we have trench warfare, and these soldiers need to be rehabilitated. Otherwise healthy 18 to 23-year-olds who have been injured in war. And that's really the lens that was first developed to view our clients, where we have a client who is injured. There's been an incident and they're injured. They're in a car accident, perhaps there was surgery, perhaps they were hurt at work, again, war, or possibly a sports injury, or even disease recovery. And disease recovery is mentioned because that's where we really saw physical therapy grow throughout our country and into communities, where it was responding directly to the polio outbreak. So this is the lens that has traditionally been used to look at our clients. And as we were growing and looking at our practice, we began to find that perhaps a healthy majority of our clients were not a product of this situation, and in fact looked something more like this, where there may have been an incident. Perhaps they got out of bed and they went to stand up and their back, quote unquote, went out. But was that an injury? Was that an incident where an otherwise healthy human being developed a very distinct dysfunction? Or was that a product of a chronic physical dysfunction that lay beneath this situation that was much more pertinent to the cause? And so in that situation, you're talking about somebody that may be inactive, there's weakness involved, their age, it's age related, it could be chronic inflammation, it could be diet related, metabolic disease. Certainly later on, we'll talk a little bit more about that. But essentially, we began to look at physical therapy through this lens, and that's where things started to change for us.
Absolutely, Josh. And you've shared that with me a few times, as it relates to the majority of the patients that you saw with that underlying chronic condition. So basically what this led you to do is to rebrand and also differentiate you guys in the market. So tell me a little bit about that rebranding and differentiation that occurred.
So I mentioned that when the Technogym catalog was placed on my desk, we really began to imagine a model of care that went beyond what that traditional scope of physical therapy practice was. And so we added most I guess important to this conversation, we added an element of what we call medical fitness to the care continuum. And later we added nutrition, where in fact what you see on the screen is our older logo, where sport was replaced with nutrition at one point. So, and then more recently, because of the expertise that we have become known for, we have been asked by a couple of hospitals now to manage what we call their lifestyle medicine and fitness center, where we actually are creating a completely integrated health and wellness service centered around physical therapy for the University of Washington Valley Medical Center here in our local area.
Absolutely. So obviously delivering an entirely different product line, in the whole rebranding of your business. So tell us a little bit more about what is lifestyle medicine, what are you delivering right there in your community, and then also, in the other health systems that you manage, and how does it integrate into the medical continuum of those organizations?
Sure. So lifestyle medicine is a term that really has gained a lot of steam and adoption in probably the last 3 or 4 years, maybe 5-ish years, where you'll note that on the previous screen, we were calling ourselves Pinnacle Medical Wellness. And 12 years ago, in 2008, as you noted, when we started working with Technogym, the term that was being used was medical wellness. There was no better term, so that's the term we adopted. And I think lifestyle medicine has certainly kind of taken over as the main point of the main way that people describe this service. So before we can really define lifestyle medicine, I think it's important that we talk about what it's meant to do and what it's meant to treat. And what we're talking about working with is what is an epidemic in our country. And when we say epidemic, I'm not talking about COVID-19. Thankfully, I think we're all tired of that. I'm talking about something that probably should be considered something worse. 80% of the healthcare spend in our country is related to chronic disease and chronic metabolic disease, to be more accurate. And it contributes to about 63% of all the deaths in our country. So just as a point of reference for that, we have literally shut down our country in the last 3 months, and the world has done so as well, to really stop what we see as a major threat to life. And that's in anticipating about 200,000 deaths. Those were like 200,000, 240,000 was like worst case situation is what was predicted. It's not going to probably get that high, but that's a high number. And that is certainly something to take very seriously. But take note, every year for the last 25 to 30 years, 650,000 Americans have died every year from heart disease alone. And this is a completely avoidable situation. These are lifestyle related conditions that don't have to happen. And so essentially what we're dealing with is something that I don't just describe it. In fact, it would be faulty for me to take credit for it. But we're talking about metabolic syndrome, where we're talking about very significant lifestyle related conditions that sometimes I go as far to say as these are self-inflicted conditions, not on purpose necessarily, but they are conditions that we obtain through our own choices and our culture. So when we talk about lifestyle medicine and what it's meant to treat, we talk about obesity, we talk about cholesterol, we talk about insulin resistance. Another major epidemic is the level of type 2 diabetes sweeping across our nation right now, and the terrible impact that it has on the human body. And of course, hypertension, high blood pressure. And certainly we know that the worst case scenario of high blood pressure is catastrophic stroke. All of these things that we mentioned, by the way, have an impact on physical function, and that's worth noting as well. So if we're defining lifestyle medicine, then what we're really talking about is clinical practice that encompasses environmental, behavioral, medical, and motivational principles to the management and prevention of lifestyle-related conditions across the entire health continuum. And that's a mouthful, no doubt. But sometimes it's easier to look at, okay, well, if that's what lifestyle medicine is, that's what it is, where does it fit into the medical continuum? And we argue at Pinnacle that essentially it fits on the front side of the traditional medical episode and on the backside of the traditional medical episode. And if there's one thing that's probably that's not telling the full story here, is that area in the middle that's described as the traditional medical episode is probably even too big. It's bigger than it should be. That the traditional medical episode across the entire medical continuum of a client is super small. There's so much room on the front side of medicine in terms of prevention, risk management. And then on the backside, where we identify at-risk clients for behavior modification and systemic intervention, things that we are clearly not doing given the current health crisis in our country.
Yeah, absolutely, Josh. I'm going to jump in here and just make a quick comment and then follow up with a question. You know, we as health professionals have such an opportunity to make impacts on the population. You know, they may have to go see their doctor, you know, absolutely, for, you know, whether it be just a checkup or maybe they've had an accident, or something that's impacted their lives. But we as health professionals, physical therapists, exercise physiologists, can work with that person on, like you said, on the front end and the back end. So I guess my question here is, how is the physical therapist positioned in helping and ultimately providing lifestyle medicine?
Yeah, so that's a fantastic question. It's the reason we're all here today. And I think it's better to let the profession answer that question themselves. And fortunately, we were provided with that explanation by the APTA in a position statement in response to the Accountable Care Act. And it is powerful. It is a powerful statement, and every PT should feel proud that there's an organization that represents them that would place them into this kind of opportunity when it comes to population health. And while this particular statement is long, I want to highlight the very end, where we talk about the opportunity to help individuals and populations improve overall health and prevent the need for avoidable healthcare services. Powerful. And this statement alone would be a lot, and it would carry great weight, but they actually doubled down within the same position statement, and they went on to talk specifically about the role of the physical therapist in recognizing risk factors and the course of chronic disease, in exercise prescription and the prevention of primary and secondary conditions, in recognizing the personal and environmental factors that are in play when it comes to health and wellness. And the last one, even bigger, being integrate the principles of movement, function, and exercise progression to improve or to promote physical activity and improve health outcomes, not physical health outcomes. They don't specify that we're just solely there to make sure that people can move. It's so that they can move to achieve proper health outcomes. So I think super powerful. Again, they go a step further to talk about the role in prevention, wellness, fitness, and health promotion. And they say physical therapists incorporate concepts of prevention, wellness, fitness, and health promotion with every patient or client as appropriate. Now, this is where sometimes perhaps reality and maybe what we think should be reality kind of come into conflict. This is not something that I think occurs across every physical therapy clinic in our country. I don't believe that that's necessarily the common practice and of our physical therapy community, and we do need to get better at this. And frankly, I think that with our experience, especially, there has been a little bit of trepidation of physical therapists to step into these waters. And the reason is that if we think back to if they're looking at a client who supposedly had an event, rather than looking at maybe where there may be underlying issues, there may be a feeling with the therapist, especially if they're trying to create a good relationship with that client, that there may be little bit of a bait and switch going on here, especially in those facilities as we have membership-based services, meaning that we have a cash pay service associated with our facility. There may be this feeling like that, where's the connection between the condition and the overall health of the client? They're here for me to fix their knee. And that's been a difficult barrier to get through. But more recently, we have been provided with some really good evidence that helps bridge that mental gap, if you will. And again, full disclosure, I did not sleep at a Holiday Inn last night, so I should not try and explain this infographic. But essentially, what my wife tells me is that this graph is stating that metabolic disturbance has a direct impact on physical function, and that these types of research studies are what needs to be read and need to be done. and need to be adopted by physical therapists to help bridge that gap between that condition and the underlying health conditions that are presented in their clinics.
Absolutely. So essentially, you're talking about, Josh, what you're talking about here is exercise beyond traditional therapeutic exercise. Because as the, I'm not going to try to go over the graphic as well, but one term that sticks out to me is inflammation. So what types of things are you adopting to deliver exercise beyond therapeutic exercise? And essentially, how did Pinnacle change the care pathway and your traditional processes to include the lifestyle medicine principles?
So we'll go back and say that we'll go back and adopt the idea that there's two lenses basically to view your client. One lens is through the concept that there was an incident in an otherwise healthy individual who pretty much needs that traditional linear plan of care. The orthopedic acute situation where they're going to get 2 to 3 visits per week, for 6 weeks. They're going to respond well. They're going to work hard. They're going to recover, and they're going to return to whatever activity they wanted to return to, and they're going to be discharged, and off they go. And that's going to be very appropriate. That's going to be totally fine. And we know through 16 years of practice and going through and looking at our clients that 30% of our clients will probably fall into that category. 30%. The other 70% are the ones that are coming in that they would be more appropriate to look at the lens through some level of underlying chronic condition. And so we've developed a care pathway specific to that group to identify what risk factors they come in with. We develop a plan of care, and we call it our total health plan, to both treat the acute condition and the underlying causes of what's going on, and then we push them into a program that includes physical therapy, nutrition, behavior education, certainly, and medical exercise. And then most of these clients will go through some level of insurance-based service, and then we graduate them into some level of continued maintenance and exercise and behavior modification.
So this graphic right here, I mean, I see the circular representation here of a lot of different pieces to the puzzle, and so essentially, due to maybe certain, some physical therapists or even exercise physiologists being uncomfortable, in the delivery of some of these things, namely mentioning, true prescriptive exercise, you may have needed some tools. So I wanted to kind of dive into my next question, which is essentially, upon implementation of this new care pathway, there probably existed, there were some gaps in the way that maybe even the clinician was communicating with the patient. So those gaps led you to the utilization of some cloud-based systems, such as the My Wellness Cloud. So what did these technologies do for you when you were delivering true medical fitness versus just straight fitness?
Great question. And the important thing to do, if we're going to answer that question, is to first distinguish between the difference between traditional fitness and medical fitness. And we have heard for years, and clearly and undoubtedly, the evidence is irrefutable. Exercise indeed can be and should be medicine, that it is the missing link in many cases to dealing with this chronic disease that we now deal with. And from the onset, it looks like traditional fitness in the form of go join a gym and get fit and get off the couch looks like the right fit. And it even sometimes can fit pretty well into the model, except something's just not right. We're just not getting the results we're looking for. There is no shortage of hospitals who have built fitness centers on their campus. and frankly labeled them medical fitness. And we are not getting the results that we're looking for. And there is a distinct reason for that, because traditional fitness does not adopt the medical model in terms of delivery. In fact, it's my position that when the medical continuum pushes clients to traditional fitness, they're essentially, for the health benefits that fitness offers, they're essentially sending them to a self-serve pharmacy where they are told to go join a, let's call it a Costco-sized pharmacy. They've got every medicine you could ever want or need. And you go there and they say, welcome to our self-serve pharmacy, have at it. And you're like, well, okay, what do I do? Well, just take something. It'll just do something and see if it helps you. And hopefully it does. And that's just not, that's not the medical model. So I would argue that medical fitness is very different from traditional fitness in that it adopts the practice of prescriptive exercise. And when I say prescriptive exercise, I'm talking about a model that replicates the medical model. And in fact, if you're reading through the screen right now, what you're reading, if you really get down to it, replicates something that you would have learned in your sophomore science class in high school, which is basically the scientific method, is what we're talking about, where we're going to develop a hypothesis, we're going to develop a plan to test that hypothesis, we're going to implement that plan, we're going to basically look for some sort of reaction. We're gonna manage the data and determine if we're getting the reaction we're looking for, and then we're going to adjust, and then we're going to document all this so we make sure we know what we did, and then we're going to rinse and repeat. And that's really what prescriptive exercise is. It's not rocket science, but it is certainly something that's very different from what most facilities, even that call themselves medical fitness facilities, do. This is where each individual, on an individual level, is diagnosed and assessed. The intervention is identified and prescribed and dosed appropriately. And in fact, what's interesting is that in preparing for today, one of my colleagues shared with me an art or a statement from the Journal of Pharmacology. It states that the pharmacology organization feels that exercise is so effective that it should be considered a drug, but that more attention needs to be placed on dosing and prescription. And that is most certainly true. Exercise is medicine when dosed and prescribed appropriately. And if it is not, then it is not medical fitness. But the question is how do you do that on a level, on an individual level, that does all these things and does it efficiently enough that it's even remotely something that a patient can afford and a medical group can afford to deliver. So yes, we adopted technology, and it was that first catalog I saw where I read about Technogym's Wellness Cloud product. And I want to make it clear that many physical therapists might be looking at the screen right now and say, yeah, we have an exercise delivery platform as well. There's a couple big ones. One is MedBridge, and they have, you can prescribe exercises for physical therapy, but this is not that type of program. This is a program that allows us to very specifically prescribe exercise, and then it creates the data that shows us what compliance is. It's the data that we need. It shares with us the data that we will then use to determine if we're getting the results we're looking for. It's something that encourages the clients to continue through data delivered to them. It provides us with a communication tool so that if there's issues going on, that basically we know about them before they become issues where we get non-compliance. So this is not the type of program that maybe some physical therapists might be familiar with. It's much more dynamic than that.
So Josh, these are great examples, great images of some of the components, and you directly listed a lot of those efficiencies that you and your staff experienced in rolling out your programming, utilizing the technology. So you started down the road of sharing some of the information, and you specifically talked about the data. So what information do you share with your patients, and how do your clinicians explain it? What does the My Wellness Cloud do to assist you and make this process efficient and more comfortable for your staff?
So we have a very strong belief system that engagement in lifestyle modification centers around constant feedback to our clients. That historically, where we've made so many errors in health and wellness, is that a simple scale of weight has been used to provide feedback to clients in terms of whether or not they're making progress in health. And we don't even use weight when we're talking about progress with our clients anymore. And so the amount of information we provide is vast. Some of it is seen here, where we, again, we're providing information around what their progress looks like against the prescription that we've given them. We share with them that how their compliance or non-compliance is affecting their progress. We share with them the results of how their resting heart rates have improved over the last 30 days because of the programs that they've completed, which we can bring up on a screen. But even more importantly, it's not just about us sharing information, it's also about the client sharing information with us. And so again, if we're talking about the difference between what many PTs know as an exercise prescription tool, this exceeds that on that side. So we're able to get information from our clients through third-party wearables, for example, so Garmin, Polar, those types of apparatus. We are able to get information from those clients in terms of what they're doing outdoors, where perhaps they're sending information to the cloud through Strava or MapMyFitness or Garmin Connect. We know what their heart rates are during all of those exercises inside and outside of our facility, and it's recorded into the system. And so we're able to essentially work with our clients throughout their entire wellness ecosystem, in clinic, out of clinic. And to be honest, that to me is the holy grail of being able to deliver medicine outside of the episodic nature that we've been delivering for the last 100 or more years. And so that's how we would use My Wellness. And then we add another element too. One of the things that we do, for example, and this is one example of the benefit of using My Wellness. We also use what's called an in-body. This is a bioimpedance type of scale, and it provides us with tremendous information to get baseline numbers, and then be able to do in less than 5 minutes with our clients to start to show some of the physiological changes that are occurring within their bodies, which is fantastic. What's cool about that is that the in-body sends that information directly to My Wellness and updates their account there. And then in addition, in order to have really in-depth conversations with our clients and to engage them with data, we've actually developed our own software program that also sends information and takes information from My Wellness, which would include our ability to provide their health in one simple number that we can then dive deeper into to understand what's impacting that number. But we can also determine what their engagement levels are through automatic engagement strategies, where we send surveys to them, and then the system tells us if there's a problem. So we share a lot of information with our clients, but our clients share a lot of information with us. And the important point there is that we then use the information. It's pointless to have a bunch of information and then not do anything with it.
Absolutely. That method of communication is exactly the importance of this. And I appreciate you sharing, Josh, some of the technologies that you've invested in and how ultimately you use those to deliver lifestyle medicine. So where I want to transition now is to kind of the financial model. You know, I get the opportunity to travel the country and visit with you know, multiple physical therapy clinics, medical fitness organizations, and you know, we're all talking about the financial model. How can we make money at this? Obviously, you've invested on the front end into, you know, various platforms. So what strategies have you deployed to make this delivery of lifestyle medicine financially viable to your business as well as for the patient?
Great question. So we remember, let's go back to the beginning of this, where we talked about one of the primary reasons for going down this road was to alleviate ourselves from the 100% reliance on insurance-based reimbursement. So if there's questions in the queue already, some of it might be to the degree of, well, this all sounds great, but how do you get paid for it by insurance? And full disclosure, we don't, directly, that is. And there are some indirect ways that I'll talk about in a second, but that's not what we're trying to do. And in fact, you know, if we're successful here and someday it's seen as valuable to the system, the services we provide, that insurance comes to the table and wants to pay us for it, we're not going to turn it away. But frankly, even from a personal level, a lot of times I think insurance is misinterpreted. Insurance is meant for unforeseen events, and the events that we would talk about as they relate to lifestyle medicine may not even qualify under that particular case. So we've developed 3 kind of areas in which we are able to make this work financially. And the first category would be under direct retail strategies, and that would be cash pay services. So where clients themselves see enough value in what we're doing that they're willing to pay us for these services. And the most basic would be a membership-based service for our clients, which our hallmark program is called Lifestyle 365. It's a very defined, very ordered program that occurs on one of 2 levels. Clients can sign up for a facility type of membership, or they can sign up for a non-facility membership. And that non-facility membership is only possible because we're able to connect with our clients completely and effectively outside of the facility using the My Wellness Cloud. And we have a lot of clients who never step foot in our gym. They come in from time to time to meet with their well coach and to talk about some of the different improvements they may want to be making, but otherwise they're doing their work outside of facilities. Some are even members of other fitness facilities. And then after the membership-based programming, we have program-based services, and those are under the name, one is Healthy Foundations. That's a 16-week lifestyle intervention program. We combine physical therapy, nutrition, and a very strong educational piece to bring our clients to the level of lifestyle modification that needs to take place. Healthy Foundations has a twin brother or sister called Surgical Optimization. And it's the same 16-week program. It's for clients who have been deemed too unhealthy to have elective surgery, and that's identified through different mechanisms. And we are able to take those clients through 16 weeks of programming where hopefully they're able to achieve better health and get the surgery they need. The other one that's worth mentioning is our PT Extension program. For those physical therapists listening right now, they know that the last several years, we have encountered numerous utilization restriction policies by the insurance companies where, you know, we've almost got to the point where we are just assuming that we get a maximum of 10 visits with our clients. And we just know that for the 70% that we're looking at through this new lens, that's not enough. So with copays being as high as they are today, we're able to offer an extension program where the clients continue to come in a point-based services for the price of a copay. And we do not bill insurance for those visits. So And then the last one is we've made great strides in working with post-cardiac rehab clients, where we know that 12 weeks of cardiac rehab for a 70-year-old who spent a lifetime working themselves up to a heart attack, that 12 weeks of cardiac rehab just simply isn't enough. And so we've really grown that program recently. And then the second category is what I would call service enhancement revenue, where we are enhancing the services that were already existing in a way that it is financially measurable. So for example, our facilities are able to provide a level of service that exceeds what we might have been able to do before we became a lifestyle medicine facility. And so our visits per case have increased due to that. Another one is that anecdotally, we under four circumstances now, we have opened the Lifestyle Medicine Center from a traditional therapy clinic. And in every single case, we've seen exponential growth in our referrals. In 6 to 8 months, generally double what we've been seeing before. Another one is that there's a natural opportunity to introduce and support ancillary services, such as nutrition counseling. Nutrition counseling is a billable service to insurance. It is something that can be related to physical therapy, and it's a reasonably lucrative service. It can be. Another one is that being a lifestyle medicine provider, we have certainly broadened the scope of what kind of PT referrals we get. So we are now seeing many more clients under a broader scope. And then all of this results in a more efficient use of the people in our facilities and the facilities themselves. And that can't be ignored financially as well. And then the last one, which is less tangible, but certainly just as important, is that this makes us relevant in a value-based care model. And whether we're all on different sides of when that's going to show up, but most people agree that value-based care is coming. We don't know when, but it's coming. So let's be prepared. The other one is that it moves physical therapy further upstream in the care delivery model. We're relevant in a larger conversation. We're seeing patients sooner. We're seeing them more frequently, creating more of that circular relationship that we're looking for versus that linear discharge, off you go, maybe we don't see you again, maybe we do, type of thing. And then the last one is that it helps us develop a synergistic relationship with other medical providers, where we are meeting them at a level that is different from the frustrating kind of relationship that we had before, which is where we would show up with cookies or some sort of treat at an orthopedic surgeon's office and hope that they like our treats enough that they'll send us clients. We're now working at a different level where we are equals in that relationship. And that might be actually the most important thing of them all.
Josh, I totally agree. The first two columns on this slide, that's just valuable information. I thank you for sharing that with all of us today. But in the third column there, which is the increased opportunity, that's the future. And I think we all, that goes right along with the title of this presentation. The future is now. So we need to look at those increased opportunities that delivering lifestyle medicine provides. So we're going to wrap this up with my last question to you, which is essentially the future of lifestyle medicine. So we have to integrate this into the entire healthcare continuum, as you mentioned in the first part of the presentation. So how else have you managed to build onto your lifestyle medicine model so that it becomes involved and further integrated into the healthcare model?
This has led to a variety of opportunities for us, and especially in the last 3 to 4 years as lifestyle medicine is really beginning to catch steam. So we went from owning our own facilities and doing this on our own to being invited to to hospital organizations where we took over their physical therapy departments in order to build a lifestyle medicine service line. And in doing so now, as I mentioned before, there's a fairly large hospital here in the Seattle area, southern suburb of Seattle, where we are now not just running their physical therapy department. We have taken over their medical fitness center. We've taken over cardiac rehab. We've taken over diabetes management. We've taken over nutrition. And we are probably not done with that yet in adopting additional services. We are in active discussions around providing services to the orthopedic surgeons on the campus in their ASC. And we are actively involved in discussions and working with the cancer care center that's being built on campus as well. So I guess to answer your question, this is where I see why it's so incredibly exciting that physical therapists who, by the way, who else is more qualified in the medical continuum to provide this type of service, both in terms of their existence in the community already and their education and expertise in understanding the human body the way they do. And so where I see this really going is that we ask ourselves all the time the age-old question: how do we break down the silos of medicine to create a better end user experience? And that is the question that's perplexed people for a long time. And I guess the answer for me is that we don't break those silos down, that's almost an impossible task. But what we do is through lifestyle medicine, we build a network of fibers that connect the various service lines. And in doing so, we create a network of services linked to preventing and managing the conditions that people are showing up with. And that's really what lifestyle medicine is. And if physical therapy becomes the leader in that, then they become the leader in medicine in many ways. And I just can't think of anything more exciting than that.
Absolutely. That is the future. So Josh, thank you so much for sharing all of that with us today. I know we have a few minutes to spare here, so I'm going to transition it over to Keith Kaminsky, who's going to look at some of the questions that we have for you today, Josh.
Great. Thank you, Josh. We've got several questions to get to here. So the first one is in relation to your patients and engaging in your services. Do you ever hear from patients why they don't belong to a traditional health club, or if they do belong to one, why they might not be going?
We absolutely do hear all the time. And in fact, that's part of the reason that we went this direction, is because initially we did adopt the practice of recommending to many of our clients that once complete in our care, that they join a healthcare facility. And it resulted in a lot of emotion, and it resulted in a lot of trepidation, and we began to really seek answers as to why. And traditional fitness is a fantastic business and service to our community, but there are some people that it is just not meant to service. And those facilities, if someone has not at a younger age been introduced to them and understands them, can be very intimidating. The business itself is set up for some individuals to be very intimidating as far as their willingness and wanting to work with personal trainers, for example. In many cases, a traditional fitness facility can resemble a see and be seen type of place, where if you're 54-year-old female and you've not taken care of yourself, that is not something that is relished to go and compete with a 19 or 21-year-old in spandex who is just in great shape because they're 21 years old. So there is a lot of reasons. Again, people will join. I think the statistics are 80% of Americans at some point in their lives have joined a fitness facility. But going back to the self-serve pharmacy, why are there 30 treadmills in a traditional fitness facility? Because it's the most intuitive piece of equipment. People know I can get on that and I'll maybe look like I know what I'm doing. But do they have a plan the next time they go? Do they know what they want to accomplish the next time and the next time and the next time? Probably not. So there's a whole host of reasons why someone may be intimidated or may not see value or just may not go to traditional fitness.
All right. Thanks, Josh. So we have another question here that's the other side of this coin. So you just said that there's an opportunity here. There's some people that won't go to a traditional health club, even though so many clubs provide amazing experiences for their members. But on the physical therapist side, you mentioned, there's some barriers to physical therapists kind of adopting more of this lifestyle medicine model. How have you overcome these barriers in your own organization?
So the primary barrier that you speak of has been education. And once upon a time, I confused resistance with our practitioners not knowing what they were supposed to do. And as I said earlier, one of the major hangups early on, particularly, was that we didn't have the processes or the programming or the natural progression of patients that to help our therapists communicate those needs and to not have it look like a bait and switch situation where a client has come in and they have low back pain and the therapist had a really difficult time transitioning from the condition to the fact that that person was in poor health and needed to probably be part of a larger scope of care, which did and would involve potentially some level of membership-based services, for example. And practitioners, there's one thing I've learned in trying to do this and do it well, is that practitioners do not like reaching in the pockets of their clients. And they will resist doing so unless they have very good reason and they feel confident in what they're recommending. And so that's where we have seen tremendous barriers, but I can tell you that where we've also seen quite a bit of progress in the last 4, 5, 6 years. Yeah.
So Josh, thanks for your answer there. And it reminds me of a healthcare fitness integration summit that I attended last fall, hosted by Club Industry. And one of the key barriers that they mentioned about how come there's not a better connection between healthcare and the traditional fitness industry was simply lack of trust. So even in with your own four walls, you had to build that trust.
Absolutely. Yep.
So we have a question from Bob Boone. Bob Boone, a longtime Technogym partner with the Medical Fitness Association, and would encourage everyone on this call to check out the Medical Fitness Association for additional resources and tools for integrating and establishing a medical fitness model. Bob has a question. Are there any stark rule implications for self-referral for your own lifestyle programs?
No, we have not encountered any issue with that. This is something that certainly we are certainly not new to the scene in offering some sort of membership-based alumni, if you will, programming. That's where in physical therapy, we saw the earliest phases of what I would call lifestyle medicine principles within physical therapy, where there was just the gym that existed and there was some level of membership-based services for alumni that were offered. So we are not able to refer in physical therapy in the most strict sense, in terms of, we can't refer to a primary care doc for blood work, for example. But so referring, quote unquote, referring to our cash pay services, there is no issue with that in terms of Stark laws. We do need to be careful in having our Medicare clients sign documentation that they are leaving the insurance world and entering into the cash pay world. So we do that, but we have not had any issues with Stark laws.
Right, thank you. And along those same lines, another question came in to dealing with HIPAA compliance and some of the technology solutions that you have. Any challenges there?
So yeah, of course, those are important questions, and certainly, I would argue that they've been in many ways a barrier to our ability to share information across different platforms and that type of thing for sure. So as far as HIPAA goes, we use a practice management software that's HIPAA compliant for our physical therapy clients, and when they leave our physical therapy practice service line, they are entering into our medical fitness service line. And we have been using Technogym for some time. Technogym, the My Wellness Cloud, does have a HIPAA compliant platform, or it has in the past. I think that they had some issues with how many people were actually adopting it, but I know that they have in the past. So we have not. I'm not sure. I would need more specifics about what, maybe specifically somebody would be worried about in terms of HIPAA. But if someone graduates and joins a gym, 24-hour fitness, for example, that they're not subject to HIPAA compliance. And while we do have one facility, it is kind of the same situation.
Yep. And Josh, I would say Technogym does have a HIPAA compliant solution. And I know, Jason, we've had several conversations over the last several years with customers. And when they really understand the differences and the implications of what that means, medical institutions are choosing the non-HIPAA version of the My Wellness Cloud because there's some more openness and flexibility in that solution. So thanks for that. Final question we have is, have you seen a growth in your own traditional physical therapy practice in terms of traditional physical therapy visits?
Yes. And so that's a broad, when we say traditional physical therapy visits, that's kind of broad because we, again, we only look at 30% of our clients as quote unquote traditional, meaning that they qualify as mostly healthy individuals who have had an episodic event. So have those patients increased? Yes. And I'll tell you why. Because we have managed to create a relationship between ourselves and the orthopedic surgeons on the side of our pre-surgical optimization, which is not something that those particular clients need. But the fact is that we're just speaking a different language than everyone else. And orthopedic surgeons, I've come to learn, really don't know as much about who we are or what we do as we would want to think. And so the person that's out there speaking a different language is just standing out from the rest. And in doing so, that's allowed us to establish tremendously better relationships where we're no longer taking cookies and candy to the doc hoping that he'll send us more clients. So I would say absolutely yes, 100%.
Perfect. Thank you for answering those questions, Josh. And for everyone still on, we have most of the group has stayed with us through these questions. Thank you so much for joining us. Josh Lyons, again, thank you very much. For those looking at the screen, you could see Josh's information as well as Jason and myself's email if you have any further questions to follow up. Jason, great job as always. Appreciate everyone.
Thank you, guys.
Have a great day.
Thanks, everybody.
Goodbye.